Hi, my name is Alex Orr. I'm from Columbus, Ohio, and today I'm here seeking your support for Bill 177, which is the Better Access to Care bill. This bill would remove the collaborating physician requirement for advanced practice registered nurses here in Ohio. Removal of the collaboration agreement would allow certified nurse practitioners, certified nurse midwives, and certified nurse specialists to practice independently, provide better access to care for patients, and ultimately allow them to practice to their full scope. The collaborating agreement prevents APRNs, advanced practice registered nurses, from practicing independently. According to the American Association of Nurse Practitioners, an individual must first have a bachelor's degree in nursing, carry a registered nurse license, and be a graduate from a program that is nationally accredited and meets national standards for clinical education and advanced didactic, as well as passing a national board certification exam. Even though these national standards for advanced practice registered nurses, APRNs, exist, there are still inconsistencies in how legislative bodies and state laws license and regulate. In states that allow APRNs to practice to their full authority, licensure is not based upon physician collaborations or contracts. Studies show that states which allow full practice authority are more likely to have APRNs who practice in the underserved and rural areas with the highest safety standards and quality of care. In states that do not allow APRNs to practice to their full scope of authority, there's a shortage of primary care providers, healthcare costs are increased, national health rankings are lower, and there are higher healthcare disparities. Passing this bill will lead to greater access to care for patients. In the state of Ohio, nurse practitioners can provide primary care, preventative care, acute illness services, as well as promote and evaluate patient wellness. Nurse practitioners can also prescribe medications and other therapeutic devices. However, to perform all of these duties, they must be with a collaborating physician. Collaborating with a physician in Ohio means that a physician must be practicing in the state and engaged in direct clinical practice in the same specialty or a similar specialty of the nurse in collaboration. APRNs who want to manage health care for patients in rural areas, places that typically have less physicians, must have a collaborating physician. What this means for patients is less access to care by limiting these APRNs to physician collaborations. If an APRN is in a collaboration agreement with a physician and a physician retires or decides to open a clinic elsewhere, this leaves patients without a provider. The community would be losing not only a physician, but as well as another provider, and then they would have to find services elsewhere. APRNs are asking to practice to their full scope. They're not asking for an extension in their role. NPs assess, diagnose, treat, prescribe medications, and other therapies. Passing this bill would allow them to fulfill all of these responsibilities. They are certified to do, so just taking out that collaborating physician aspect. It is estimated that there will be a shortage of 120,000 physicians by the year 2032, while there will be a steady increase of NPs in the workforce. In order to provide more access to health care despite the decreasing numbers of physicians, removing this collaboration agreement would allow for an increase in the number of FNP providers available. These arguments are just a few of many for removing the collaborating physician requirement. Allowing APRNs to practice independently and to their full scope would greatly benefit patients in need and communities which would otherwise be underserved due to the shortage of primary care physicians. Thank you, and I hope for your support.